Americans could soon have a fourth option for COVID-19 vaccines, and it's not like the others. Joining us to talk about this, Dr. Jeff Potoff, UW Health Chief Quality Officer. Doctor, great to see you. The Novavax vaccine, it clears a huge hurdle today, getting the green light from a federal advisory committee, and it's late to the party. We already have 3 other vaccines that are already available. What can you tell us about Novavax?
Well, I think the thing people are going to talk about Novavax the most is it's an old school vaccine. So if you're the kind of person who likes carburetors in your car, you might like the Novavax vaccine. It's a protein-based vaccine. They replicate the protein that is the spike protein of COVID-19. They grow that in an insect cell line, and then that can be injected. This is in comparison to our mRNA vaccines, where we make the body do the work. We give the body the instruction book, the recipe to how to make the spike protein, let our cells do it. And at the end, you get this immune reaction against a spike protein against COVID-19.
Yeah, you said it. This has been described as kind of a traditional vaccine. The process has been used for decades in vaccines for like hepatitis B, HPV. So how many times has someone talked to you in this pandemic and said, I don't know, these vaccines, they are just too new? This might be a good option for those people.
I agree. I think for those folks who really were hesitant because of the technology involved in the original vaccines that came out, if that really was their hesitation, this takes that away. This vaccine is very much like other vaccines that people are very used to, like you mentioned, for years, decades already.
And Novavax says the shot's 90% effective in keeping you from getting sick, although we have to say the data came in before some of these subvariants, the Omicron, the Delta. They do say it was 100% of the people in their trial did not have severe illness. No one died. So today's advisory committee, they were convinced that this is safe and effective.
Yeah, I think certainly it's safe. And although, that exact effectiveness, we don't know because we haven't tested it against Omicron, it's mapping pretty well against other vaccines. So prior to Omicron, 90% effective. It's probably not 90% effective against Omicron, but, pretty good against no symptoms at all. And most of the vaccines that are out there are really good against protecting against severe disease, which is really what's most important.
This vaccine's been plagued with production issues that experts say may slow down the approval of the vaccine. But we have to say, despite that, 42 million doses have already been sent out around the world to countries that have approved the vaccine. I had not heard of Novavax. I may have read about it once, but it was not on the top of my mind. But this is not necessarily a brand new vaccine. I mean, it's been in circulation.
Yeah, Novavax has been out there, obviously not in the United States. We're just talking about it today, but that does give us, a little bit more data on safety, efficacy. And although they did have difficulty with, producing enough of it, that's important when the FDA looks to approve things. They want to make sure it's available if they approve it. But it looks like a lot of those production issues, Novavax was able to get straightened out.
I think it has one of the best names of the 4 vaccines that if it gets approved. So another option. Options are always good. Wish we had more options for gas. Dr. Jeff Potoff, UW Health, appreciate your time.
Thank you.